Proposal being put to the federal government suggests locking away some of a person's superannuation to fund their future aged care. It's one of a series of ideas proposed by industry stakeholders at a summit in June, after reports the country's aged care budget is expected to grow to $40 billion per year by 2026. The paper argues higher taxes and greater consumer contributions will be needed to ensure services can be maintained into the next decade. The opposition agrees more funding is needed for aged care, but other revenues and avenues should be assessed first.
I don't think this is a good idea because for most Australians their superannuation might not be enough as it is. So I don't think there's this sort of pot of gold there to raid to fund the aged care deficit we're facing.
This government reaches for new taxes, levies. Something that's quick and easy and solves the problem is not the answer here. So the minister hasn't ruled out new taxes. New taxes are not necessarily the answer at all. But what we do need to see is real attention to policy detail and a commitment to getting it right.
Okay, so joining us live now is the National Seniors Chief Advocate, Henschke. Ian, good to see you. Thanks for your time. So first of all, these points that have been put forward, a new levy, something similar to Medicare. Another point that wealthier Australians should dip into their own private savings, which I think is already happening in some cases. And then you've got this option of ring-fencing super to fund aged care. What do you make of those points that have been put forward and are up for discussion?
I think a lot of people need to understand the system as it exists at the moment. And for example, the amount you may pay depends on your level of assets and income. I'm reading that directly from the government's own sheets at the moment. So already we have a user-pays system. 85% of the pension or equivalent is paid by a person going into residential aged care. And I think what we've got to look at here is we don't want to see this become a political football. And I'm a bit disappointed to see that when the opposition speaks about it, they say, oh, well, you know, not necessarily this or not necessarily that. We don't want to see a new tax or whatever. We don't want to see a political football here. What we want to do is see multi-partisan agreement on the fact that we need to improve aged care. A woman was bashed to death last week by another resident in Sydney, and I looked into that and found out that that's not an unusual occurrence. In other words, one study was done a few years ago where they said that it was around a bit over 2 people a year are killed by another resident. That's what's being reported. So we need to have dementia training compulsory. That was one of the things that was brought into the Aged Care Royal Commission. That hasn't been done. We also need to look at the aged care providers themselves, the ones who are calling for all this new funding, and see how many of them are actually making a profit at the moment.
Yeah, true.
I understand by their own figures, 34% of them are already making a profit. Now, they'll say the majority are not making a profit, but let's have a look at some of the issues there. They have very elaborate company structures. So the first thing we need to do is make sure that the money that we are allocating at the moment is being spent well. We need to make sure that the Royal Commission recommendations are being implemented, and that means compulsory dementia training, which is not happening at the moment. So you've got to have faith in the system, and we should have a logical system, we should have an ethical system, and we should have one that feels right. In other words, you've got to bring the people with you to make sure that this reform happens. We agree on one thing. We need a better aged care system.
So where is the best pot of gold to raid then, to borrow Matt Canavan's term?
Well, I don't know that you have to raid a pot of gold. I mean, you've actually got a system at the moment where you could adjust it incrementally. In other words, the home at the moment is included in the means test up to, I think, around $186,000, $190,000. Well, most people's homes these days are worth more than that.
Way over,
You could adjust that. But you could also consider bringing in a small increase in the Medicare levy, because if you look at this from a logical point of view, now just think about this. If an 86-year-old woman gets breast cancer, or an 86-year-old man gets prostate cancer, or they get lung cancer, they get treated by the health system. If they get dementia, you're saying to them, go out and actually pay for it. Well, they'll pay some contribution as they do in the private health system, but it's wrong to actually turn around and say that this is not a health issue. I mean, the health minister is responsible for the aged care system in Australia. And I call on the Health Minister today to bring in compulsory dementia training. I call on the Health Minister today to actually do a forensic study of aged care providers and find out which ones are making a profit and which ones are hiding their profits through elaborate company tax structures, so that we need to make sure that when you provide them with the money is spent on care.
All good points. Fair points. Ian Henschke, good to chat as always.